What we're going to do now is go through palpation, and I think at this point we won't really need to get tables out. There may be a few things that we won't be able to do quite as well, but what we'll do is go over that next time, maybe when we'll get out some tables. Because most of the stuff we're going to be doing is things on the skull that you can do on yourself or the person next to you maybe. Anybody have any questions at this point? Now, the stuff that we're going to be going through now is out of the trail guide book. So these are just things that we've already gone for, so we'll just review that again. Why don't we turn the light off, because at this point you shouldn't really have to write too much down, right? This is stuff that we've already gone over. So then here you have the temporalis, right? Zygomatic arch. Masseter, mandible, all these things we went over here. This stuff, I can't really see the outline. This muscle right here, anybody know what this one is? Sternocleidomastoid, or the SCM. We'll be going over that one later here. And then, what are the muscles here? Trapezius, and then also you have the levator scap. So this basically is just a repeat of what we've already seen. It gets into some of the things on the neck here that we will be going over with for palpation, but we'll do those another time. All right, so here's one of the, what they do in this trail guide book is they have like paths that you take as far as for palpation. Okay, so we'll go over these. And you have the body of the mandible is more or less this part here. Right? So this is just the bony part here. And then you come up over the edge of it here, the base, and then you have this submandibular fossa, right? If you sort of palpate, you can kind of feel that little opening in there. Okay, and then you go back over to here and you have the angle of the mandible. This is basically the corner of the jaw. And then you work up towards that way here, and then what's this muscle right here? Masseter, all right? And then if you come forward here, what's the part of the bone that, when you open your mouth, that comes forward into your finger? Coronoid. Yeah. So you got to remember there's a coronoid and there's a coracoid. Okay? This is the coronoid, this is the coracoid here. Okay? And then as you go back, following along that zygomatic arch, right at the back part of the zygomatic arch, if you move your jaw side to side, you'll feel, if you move this out, if you move the jaw to one side, you'll feel it on the contralateral side. Remember when we say contralateral, meaning the opposite. So you move to the left, on the contralateral side, you'll feel the mandibular condyle pop out. Okay, so now we're talking about the occiput. And then we'll do this another time when we get tables out. But basically, if you come over to the mastoid here, and then you're coming across towards the middle part here, you'll feel like where the junction where the muscles attach into the skull, that's going to be the superior nuchal line. And you'll come across, and then you get into the middle, and you'll feel what's called the EOP. Yeah, EOP, external occipital protuberance, which is the lump in the middle. Some people are going to have larger ones than others. So you go along that ridge. And then deep underneath that, now you're palpating through the muscle. You're going to be going into this inferior nuchal line, which would be down here. So that's where you'll feel kind of where you get, here's the upper part here where the muscles are, and then where you feel the bottom edge of the skull, Where if you go underneath it, there's no more skull, and there's just a mass of muscle underneath. So that's going to be the inferior nuchal line. Okay? And a lot of times there's a lot of trigger points and things up under there. You got 11 points. What is it, GB20, right? Yeah, and then 21's in the track. So if you take your hands like this, and then you can kind of work and then work under all those muscles right there. Because you don't get any headaches from studying too much, right? Or neck tension. You don't know that. Right? So, you can work all under there. Copy that. And then you mentioned on the mastoid, and now what bone is that on? Temporal bone, right? Okay. So then now you have the parietal bones. And that's, as you come in, you have the frontal back here, then the parietal is basically kind of the back corner here like that. And you're not going to be able to necessarily feel the sutures, but if you feel this external occipital protuberance and you start coming up the back right here, there's sort of a point where the skull tends to kind of curve forward like that. And that's pretty much where are going to be these convergence of the sutures here between the occipital bone and the two parietal bones. You may or may not be able to feel that. And then that's where the palpation comes in. You want to have more of a light touch when you're palpating, especially if you're going to try to feel something like a suture. Okay, on infants, when they have those impressions where the bones haven't quite come together, those are going to be at these junctions of the different sutures. All right, so temporal, we pretty much covered that already. You have the mastoid process, zygomatic arch, and there is a styloid process, which is going to be this little tip of bone right here. Right? And the way if you're going to want to find that is you go from the tip of the mastoid here, kind of anterior, inferior, and it's going to be in there deep. Okay? That's going to be an attachment for some of the other structures that are under there, but it's not necessarily something that you're really going to be able to palpate. But obviously the mastoid is a good one for a landmark. And this one's we pretty much covered here already, where you have the temporal mandibular joint, and we're not really going to get into that too much, and I'm not sure it's covered in other classes, so you just want to be aware that you do have this disc right here, right? Because a lot of times patients will have temporal mandibular joint dysfunction, and you do have some of these pterygoids that do attach to the disc, because when you move the jaw forward, it's not a joint like this where it just stays in like that. What happens is that mandibular condyle, there's kind of a hill that it comes over and it comes forward, so it doesn't sit in a socket. It moves and it comes forward like that. So when you do that, that disc has to move forward too. So that's why these muscles attach to it. So when the jaw moves forward, the disc goes with it. Because on this, on the bottom of this joint here, and we can pass this around if you want, but you'll see there's like this little ridge right here. So this condyle, when it opens, it doesn't just open like that, it actually slides forward on that kind of a little hill right there. So this is just talking about like what we've done, where you can feel the mandibular condyles moving forward here, and then actually talking about feeling underneath here. There's a parietal gland and different glands and lymph nodes and things under here. Palpation-wise, if somebody has an infected throat or something, you're going to have enlarged lymph nodes. And then again, here's this coronoid process, which is the one that comes forward. And what muscle attaches onto that? Temporalis, yeah.